The world's first bladder transplant occurred this week, which is amazing. It was successful. The patient's alive. They've transplanted actually a bladder and a kidney for this patient. The bladder is deep in the body. It's something that is actually complicated as far as blood supply. There's left and right-sided vessels. There's multiple connections. If you think about the bladder, it connects to the kidney tubes, the left and right ureter. It connects to the urethra, which is how you can pee. And then you got the arteries and veins. Here, to make things easier, while the bladder was on ice before it was transplanted into the recipient, they actually reconnected the arteries. They connected the arteries and veins, so instead of a left and right, there was just one, which makes it less complicated when you're trying to plug it into the recipient's blood system. Why would you need a bladder transplant? Well, there's a couple of reasons. One is if you have bladder cancer. When we operate on a patient who has extensive cancer of the bladder, we have to remove the entirety of the bladder. And once the bladder is gone, you still make urine, and you have to do something to get that urine out of the body. And we'll take the ureters and sometimes connect them directly to the skin or via a separated segment of bowel from your own bowel system, and the urine can travel outwards that way. We'll even create a new bladder. We use a segment of the bowel, we separate, and we fold it up into a sphere, and that functions as a bladder. Now, the reason we got to this transplant is those systems don't work well. Patients don't like having a bag usually, which drains the urine from as it's emptied through the skin. And if we create a new bladder, one problem that we see is, even though that everything is connected, is that there's a lot of issues with your electrolytes. They get reabsorbed because the function of the bowel is to reabsorb things. And the patient can have a lot of electrolyte abnormalities and other issues too, just because we're using something that isn't meant really for urine. This study, which was done to look at bladder transplants, is being done in LA at UCLA, USC, and they're looking for patients who have a history of bladder cancer in control with the bladder being gone. They're looking for patients who may have other reasons that they can't have their bladder, severe pain or disease, infections. And then additionally, they'd like to see if you're immunosuppressed. If you're on dialysis and you need a kidney, because if you get a kidney, then you're going to be on immunosuppression. Immunosuppression is basically where we turn off your body's own immune system to allow this foreign organ to survive. We try to match this organ as completely as possible to you or to the recipient, but that's